Okay, thank you. Good morning, good evening, everyone. Welcome to our clinical nephrology webinar. Our webinar for this year is the sixth webinar now. And today we have a special guest from GlomCon, and he will be taking us through the overview of the GlomCon Glomerular Disease Fellowship. But before we hand over the mic to him, I would like to introduce my co-moderator, Dr. Mohammed Hassanain. Dr. Mohammed Hassanain is a consultant nephrologist in Egypt with a special interest in glomerular diseases and onconephrology. He spent 9 years in the United States, where he completed his nephrology training at the Cleveland Clinic and worked as an assistant professor of medicine at the University of Mississippi Medical Center. He is a double American board certified in internal medicine and nephrology, and he graduated from the inaugural class of the GlomCon Fellowship, after which he joined the educational committee of GlomCon, and he has been a GlomCon instructor ever since. So with that, I hand over the mic to Mohammed, who will introduce the speaker, and we'll then start our talk. Thank you so much for joining.
Thank you very much, Dr. Amirali, for the kind introduction. It is my distinct pleasure to present our speaker today. It's Dr. Harish Sitapathy, who is actually, he was my former program director when I did the GlomCon Fellowship. He is currently a clinician educator in the Division of Nephrology at the Mass General Hospital. He is also an assistant professor of medicine at Harvard Medical School in Boston. His clinical interests basically span across multiple areas of nephrology, including glomerular diseases, onconephrology, and outpatient dialysis. His research focuses on the nephrotoxicity of novel cancer agents, including immunotherapies and targeted therapies. He has published multiple papers in the field. He was the co-chair of the educational committee of the American Society of Onconephrology during the year 2022 to 2023. He enjoys teaching students, residents, and fellows, and he serves as the director of education at the Brigham and Women Mass General Nephrology Fellowship Program. He also serves as the core faculty for the core eye clerkship at Harvard Medical School. Harish, thank you very, very much for joining us today.
Thank you so much for the kind introduction. It's such a pleasure to talk to colleagues from across the ocean. The title of my talk today is Can You Hear Me? It's a brief overview of what we do with the GlomCon Fellowship here, and it's such a pleasure to be talking to all of you today. So what is this talk about? I want to give a brief overview of education in the Zoom era because a lot has changed in the last few years. I think pre-COVID, we were using Zoom somewhat intermittently and for certain purposes, but nowadays I think everybody's gotten used to doing a lot of things remotely, whether that be clinical work, education, or otherwise. So I want to talk about where we are going with education and what is good education versus effective education in the Zoom era. And of course, keeping the GlomCon Fellowship in at the central point of view, want to talk about how it emerged and what we are doing now and how it'll influence training programs in the future. I do want to have a small disclaimer that many of this is my views only and it's opinion based. So if you have any comments or feedback, I'm welcome to hear them. And you are all nephrologists, so this is somewhat none of this is new to you in that we have a lot of new resources in the whole social media remote era nowadays, and you only have a certain amount of time to dedicate to any of these, right? So which one do you choose to dedicate your time to, and what is your purpose? So when I was a fellow, I really wanted to learn a lot about GN education. I felt like it was a really opinion-based topic. You learned a lot from senior experts in the field, but you just could not put things together. Meaning when I saw a patient, I just could not understand exactly how to diagnose a patient, how to treat a patient. I just never felt comfortable even though I was seeing a lot of patients. Yes, it was due to the complexity of the pathophysiology, maybe a lack of exposure to some of the rarer diseases. I just felt like even in a robust academic center where we are seeing a lot of these patients, my training was still inadequate. So I tried to look at other resources, right? Look at recordings from ASN, There was a Rush Biopsy conference that happens. That was a really good resource. There's some cases at NEFSIM. We also listened to some GlomCon lectures that kind of helped at that time. But what we really wanted to do was prepare a curriculum that was comprehensive, extensive, and deep enough that you really felt like you got what you were doing when you actually see patients with glomerular disease. And we wanted it to be equitable, right? We wanted to not just involve fellows from America, but from around the world to really learn about treatment practices, the challenges in treating these patients with complex glomerular diseases. So this is a roadmap for the GlomCon Fellowship. For those of you who do not know, GlomCon was started by Ali Poyan Mer as a local thing in Boston just to discuss some complex cases, and this was started all the way back in 2016. And since then, with amazing moderators, they've done so many seminars that you can, still access for free on Sundays and join for free and ask questions and provide feedback on. To date, there's been more than 200 seminars, and individuals from more than 130 countries have joined these seminars. And then, while I was doing my fellowship in my last year and I was doing a lot of research, I met Dr. Saina Nuruzi at ASN Kidney Week in 2019. I was just deeply explaining sort of the inadequacies of what I felt was my GN training, in the sense that I had a lot of exposure, but still I just didn't feel like I could put it together. And kind of she felt the same way. And we really discussed starting something that would involve discussion across oceans, across countries, and wanted to hear perspectives from different people, individuals and fellows and junior nephrologists who are treating patients with glomerular disease. So that happened, and we wrote down a whole curriculum, and we did a survey where we thought about like, hey, do others feel the same way that we feel? And we did a survey where there were more than 110 respondents from around the world, whose two-thirds of whom said they were really not feeling competent about diagnosing and treating glomerular diseases. And a particular thing that was, brought up again and again was there was no discussion of like there needed to be more discussion of treatments aimed at glomerular diseases. There needed to be more exposure to nephropathology and training in nephropathology that was severely lacking in many countries. So we wrote down a full curriculum, and we wanted to see, how many people would be willing to join it. And initially it was supposed to be this really small cohort of maybe like 10 to 15 people who would like engage in this like online course that we would discuss cases together, that would be a safe space to talk about, challenges with treating glomerular disease. But then when we opened the applications, we of course got more than 400. So we had to sort of reevaluate, take a step back and think about what we wanted the fellowship to be and how we can make it productive, and what the number should be to make it a fulfilling experience. So we approached Dr. Kate Robson, a vasculitis specialist in Melbourne, Australia, who was also a clinician educator, and asked her, hey, we have so many applications from time zones that we can't really cater to, which is primarily India, Asia Pacific, a lot of the Southeast Asian countries, and asked if she would be willing to lead a cohort on that side for case discussions and other things related. And she was totally on board, super excited. And so the very first year, we took around 50 fellows from 19 different countries, and we were able to get around 50 faculty, mostly from North America, but also from India and Australia, catering to different diseases. And we wanted to have two cohorts running at the same time in two different time zones so that we could really cater to the entire audience, and there's not a single country left behind. In the second year, we kind of expanded, right? We were consistently getting 350 to 400 applications, and we did not want to be a gatekeeper to people getting more knowledge. So we tried to expand as much as we can within the resources that we could get at that time, and we took 100 fellows. And third year, again, we expanded again. We went to 200 fellows. And this is when I think we really felt like, hey, we don't want the experience to suffer just because we want to get more people access. And so we decided that it was around that number that would be fruitful for the fellowship to have a very good and satisfying experience. And so, as I said, we do two time zones. Two-thirds of our cohort are female fellows. And then year 4 and year 5, it was something similar. We kind of did like around 200 fellows from more than 30 countries. We expanded our faculty. We run it in 3 different cohorts, but in 2 time zones. The actin and nephrin cohorts run on the US North American time zone, and the Podocin cohort runs in the Asia Pacific time zone. And with regards to the time zone, again, we wanted to include everybody and wanted to make sure that everybody had time to attend. So the nephrin cohort includes individuals from North America, South America, Europe, and Africa, and some parts of the Middle East, whereas the Portocin cohort includes folks from mostly Asia, Southeast Asia, and Australia. So these are the number of applications that we typically receive by continent. This has stayed roughly the same through the years that we've run the course over the last 5 years. And as you can see, we receive around 7% of our applications from Africa. I want to put a list of the countries that we've had fellows from. From Africa, we've had primarily the countries where we had fellows from have been like Ghana, Egypt, Nigeria, Kenya, but we've had some few fellows from like pretty much like a lot of the other countries as well. We'd love to receive applications from any country. We treat every country the same, and we try to get the best folks into the cohort, the folks that we feel would make the most difference from learning about glomerular diseases and applying this knowledge to benefit their patients and their community. And how do you design a virtual course, right? Like when we started out, we didn't just want to do lectures because lectures are freely available on YouTube or many of the course websites, but we didn't also just want to do case discussion. Sometimes the discussion can be unidirectional, can be scattered, and you don't get what you need from just case discussions that are like not really, I would say, formal, right? And then so we looked at, should it be a series of small things? And there's always this 15-minute thing that was brought up that, hey, you can't have these long sessions because 15 minutes is our average attention span, and I don't know if that's really true, but if you look at contemporary television entertainment, a lot of things are designed around 15 to 20 minutes, right? Like TED Talks, which are meant to be powerful, inspiring talks on specific topics. They are around 18 minutes. They're long enough for a serious talk, but they say they're short enough to hold a person's attention. And this is somewhat propagated around like other shows as well. Like if you look at the other shows that are on TV, on HBO or Netflix, all of them are around 15 to 20 minutes. But is that really true that attention really completely wanes after 15 minutes? There was some data from the 1970s, and this is extremely weak data that says that, hey, if you have something that's more than 15 minutes, the note-taking capacity of people like kind of drops, so maybe that's the attention span. But then they found that if you give a really good lecture for an hour, people actually listen for the entire hour and not just 15 minutes. So it doesn't really correlate that well. And there have been other sort of studies on like using clickers, using heart rate monitors, retention testing, so on and so forth. But honestly, it comes down to the basics, right? If you have a really charming speaker, the passionate speaker, the inspirer, then people listen. Or you have a topic that's so out there that you don't really get access to, that's somewhat unique, then people listen. Or the content is so useful to you that you're able to apply it in everyday practice or everyday in your everyday activities, then you would listen, right? So I think we try to like mix all of this into our curriculum and how we do it. But we also found out, and this is through experience as well, that hey, being a student and just passively listening is very easy. But actual learning requires like a lot of work, right? So how do we design our fellowship? We split it into two parts. There is an initial lecture, and this is meant to inspire. It's meant to be a launching platform for discussion and ideas. And then we break out into smaller breakout rooms where small teams discuss like actual patient scenarios that are like, the fellows go in, they think about the scenarios, and they come in with the answers and discuss their opinions with the faculty who runs the session. And as I said, the first part is meant to inspire. So we really try to get the best and we try to ask them for topics that might inspire. We don't just want a lupus lecture or just want an FSGS lecture. We want it to be such that you're talking about something that's really relevant, but we also want to inspire the future generations. And then when it comes to the breakout rooms, we actually don't ask fellows to bring the cases. We ask the faculty for the cases. We assign them to the fellows like a week in advance, and then give them to the fellows for their opinions so that they can present during the breakout rooms. This is done for a very specific reason because, when you think about lectures, a traditional lecture may have one or two case examples, right? They may talk about, for example, if you take hyponatremia, there might be a couple of examples. There might be epidemiology, there might be a pathophysiology section, there might be a diagnosis section and a treatment section, right? But this really really assumes that your interest, that is the interest of the speaker, is the same as that of the audience, right? That's often not the case. You might be interested in certain things, but not everything that the speaker has to say. But let's say the speaker flipped and did just 3 to 4 cases that illustrate the pathophysiology, diagnosis, and treatment. It might increase your engagement, but you sense that you didn't get the full picture, right? So you want a mix of both of these things to make the best out of the content that you have. So when we assign the cases, then it really encourages buy-in. They really have to do the work to form their opinions. It becomes more like a chalk talk that the fellows give to the faculty rather than the other way around during the second part of our sessions. And again, the faculty that are in these sessions are actual GN experts. They might be pathologists, they might be well-known GN experts who are really thinking about how you are treating the patient, and then they tell you how they would do the same thing. And then we have all of our sessions are recorded. The breakout rooms are not, but all of our lectures are recorded. And there's engagement on a platform called GChat that we use to like communicate with the fellows. And that's kind of how we like create post session content in terms of like we ask fellows to do take home points. Some of them write blog posts, some of them write articles, so on and so forth. And really, I said this before, is that the nephropathology experience really needs to be really robust because this is lacking in many parts of the world. So we hire some of the best nephropathologists that you can get, and we're really thankful to them for like donating their time to teach everybody, going through the nuances of nephropathology. Like even in a program like mine at MGH, like you have in Boston, you have fellows getting a lot of nephropathology training, but those that do the GlomCon fellowship are like really very like comfortable in like trying to interpret like renal biopsies. And there's of course a completely separate pathology course from GlomCon as well that pathologists usually take that makes them even more comfortable. So in terms of what do we cover pretty much everything under the sun if it, comes under the umbrella of glomerular disease. We don't really talk about diabetes, but like apart from that, we pretty much cover every autoimmune disease, some onconephrology, we do clinical trial sessions, some special sessions focusing on other things, so on and so forth. This is how a schedule typically looks. We ask for the assignments to be ready. We assign the assignments for the session like a week or 10 days in advance. We tell the fellows, hey, the fellows know when the year starts as to who's doing the assignment on what day. And then they come prepared during the session to present. They make their own slides. They present to the faculty while the faculty drive the discussion, and the other fellows participate in the discussion through questions or input, so on and so forth. And then we do some take-home points at the end of it so that everybody's on the same page as to what they learned from that session. And post-session, there's been a lot of content creation, and this is primarily due to all our instructors. Our instructors are basically our faculty, many of whom actually did the fellowship. They all facilitate a lot of the content creation, but also like inspire the fellows to like do more things. They really are part of the community and make it an actual community. So Dr. Hassanin here, who moderated today, he was one of the fellows, but he's now faculty and he drives a lot of the discussion and a lot of the content creation, so on and so forth. And we have an amazing set of faculty who help run this fellowship in addition to the faculty who teach. A bunch of really good blog posts have come out of GlomCon, whether that be history of GN or like therapies in GN, therapies in membranous, lupus, so on and so forth, and a bunch of mini reviews in kidney medicine that are really useful and like wonderful articles to read if you haven't read them. All of this comes out of, some of it comes out of the discussion that happens in some of these sessions, and then people take it and take it to the next level by like actually writing on it and publishing it. So what do you need to graduate? Basically, you attend 80% of the sessions, you treat it like a real classroom, that is, you keep your videos on, and you do your 1 to 2 assignments a year. And I think it's kind of important that there's some buy-in, right? Like when people join a course, it shouldn't be completely passive. We want you to do some work, but not so much work that it impedes on your daily sort of schedule in terms of your training, because nephrology training programs can be quite intense in any part of the world. So we don't want to impede on that at all. We just want to make sure that you have some buy-in, that when you are trying to learn something, that there's that little bit of pressure on you to push yourself to learn more. And this, you get this beautiful graduation certificate that was designed by Dr. Arbatin's, using Dr. Arbatin's figure here. And we invite the best and, the highest, best leaders for our graduation. Dr. Quagin came in a couple of years ago. So we invite some amazing folks that give inspiring graduation speeches. And what else happens after that? Meaning we provide anything that happens out of GlomCon educationally. We try to provide the fellows free access to that. For example, we had GlomCon Hawaii, the first in-person meeting that happened, and the fellows had completely free access to join all days of the GlomCon Hawaii. There's also Glompedia. Many of the authors on Glompedia, each of these chapters that were written, it's a very comprehensive guide on like both clinical glomerular disease practice as well as pathology. And a lot of the first authors are fellows who graduated from the program. We try to keep it as up to date as possible. So if you haven't downloaded it, you go on the App Store on your iPhone or your Android phone, and you can download Glompedia for free and access both guides that have most up to date information on diagnosis, management of glomerular disease, and also contain an atlas of renal pathology. So what's next? We always encourage our fellows to be faculty, whether that's with us, outside us, teach, be part of the community, and just being that community, I think, is a big part of joining the GlomCon Fellowship. We want to establish glomerular disease centers of excellences. So there's a project going on which decides the criteria on which these centers should be established. There's research consortiums. Many of our fellows and faculty participate in registry studies. And then we want to create content that's pertinent to both nephrologists and our patients, whether that be patient information or practice guidelines, so on and so forth. But as a fellowship, in running the fellowship, we constantly strive to prove that the content is worth paying attention to. That means we don't want to just assume that the content is like okay, and we just don't want to keep doing the same thing year on year. So we try to adjust stuff, make sure that you're engaged and you're learning what you came to learn, and that your expectations are satisfied. So this is how I think the future is. I think the future is that many of the education part of it is like, the didactics part of it is sort of decentralized. And instead of having like centralized didactics and subspecialization, we want to decentralize it, take it away, and put it right at the center of like where your training program should be, that you do your training program. As we all know, you can't get experience that there's no experience like seeing actual patients. So when you see all your patients, you're getting the support that you have with your didactics, that is like the same in any part of the world, while you're seeing these patients, and you have like resources and other stuff to ask questions to be involved in, to build your own community in your career. So I'll kind of end there, and I'm open for any questions and comments. Hope that was somewhat useful. And if you have fellows, a junior faculty, anybody who wants to join the GlomCon Fellowship, please ask them to apply. The applications are open now. And we've had some amazing fellows from Africa. One of the fellows from Ghana who actually who's one of our faculty now, got a physician scientist grant and is studying doing an amazing research project in Ghana right now. I'm looking forward to seeing the result of that study, and hopefully there's a lot more research collaborations and other clinical collaborations that come through. Thank you.
Thank you very much, Dr. Sethapathy, for the wonderful overview. And I know I may be biased, but I have to admit that really GlomCon is and was and has been the best thing that has happened to me academically. I remember when I first applied, and I was like, this is interesting. Let me see how things kind of work out. And then ever since, first of all, as you said, I found GN very complicated. And even though I was in one of the big tertiary centers, it was still complicated. And then the fellowship just really made things very easy in a very friendly atmosphere. And then everything that kind of spiraled after, like the contacts that I made, the papers that I published, the opportunities, it just opens doors for many, many, many opportunities. So I would definitely recommend it. And if anybody has any questions, please go ahead and unmute yourself.
If maybe I can ask a question while we're waiting for the audience to ask the questions. Thanks, Prof, for that enlightening presentation and keeping everything in context and getting us up to speed on how everything works on the other side. I just wanted to ask, with regards to the fellowship itself and the cost coming from third world country or low middle income country. Is there any sort of concession for people from this side compared to the developed countries?
Yes, absolutely. We do charge for the course in the sense that it's by the World Bank income categories, like high income, middle income, and low income. So the charges are different and significantly, discounted for the low income countries. But I also have to say the money that is collected is used to run the fellowship in the sense that we use that for the admins and we offer to pay the faculty, and many of the faculty decline payment. And so they donate it back to GlomCon. And when they do that, we basically give it back to the fellows. For the last 5 years, I don't think a single fellow from a low income country has not been compensated. So they've been, like, when they pay initially, we've been able to give it back to them by the end of the year. Just because when the faculty donate back, then we don't keep that money, we just give it back.
Thank you, Prof.
I
I see
think,
there are a
yeah,
couple
there's
of
a
questions in
question.
Q&A.
Yes, our recordings available for review, yes, but only for the fellowships. If you join the fellowship, the recordings are available only to the fellows because it's a safe space. We want to make sure that whatever's inside the fellowship doesn't go out. The Sundays are free to attend, so if you go on the GlomCon website and sign up for the newsletter, you get a link to attend the Sundays every week, and that's free. Can pathologists apply? Yes, but I would strongly advocate. I would strongly advocate applying for the pathology certificate part of it, because the renal pathology that we discuss here is very clinically correlated, and it's how nephrologists think. So I think if you want to learn deeper pathology and the nuances of like renal pathology, then I think perhaps a renal pathology certificate would be better suited. Yes, pediatric nephrologists can definitely apply. We have had, I think, at least 5 to 7 pediatric nephrology graduates. But please note in your personal statement as to the reasons as to why you want to apply. Most of our sessions are definitely adult oriented, but of course we have minimal change, FSGS, we have therapeutic sessions, clinical trial sessions, all of which are pertinent to pediatric nephrologists too.
Dr. Sitapathy, I also wanted to mention that isn't there a discount if we have like 2 or more fellows that are accepted from the same program as well?
Yes, so I think there's a 25% discount if there's like more than one fellow from the same program, just to encourage people to apply as a group, because that's been asked multiple times before, especially if the program is the one funding it. But again, I think that sort of committing upfront, meaning paying that money and committing upfront, makes a big difference to us, because we feel like that really encourages people to like attend the sessions and do things. Though we try, especially for low income countries, to like for the last 5 years we've done it. I can't promise how it's going to go year on year, but we try our best to like give it back. And if we get grants in the future, if we get other stuff in the future, then it might be a better financial situation for all of us. But the developed countries basically pay so that it's equitable and it's the same education for everybody, and we try to like keep that going. And there is literally zero difference, in terms of like in whichever country you join from, you get the exact same course, and there's no difference in the engagement, the sessions you participate, the assignments you get. None of that is curated to a particular country or a particular region. They're the exact same. The schedule is, yeah, it's around 23 to 24 sessions a year. So it's kind of every other week, except for some months when there might be ASN or NKF or other conferences, and then it becomes every week. The dates are on the website. So if you just go to GlomCon, if you just type on Google GlomCon Fellowship, you will see the dates on the website, as well as what the commitment is and how to apply. I'm just going to put I think somebody asked for the application link, so you'll just see it. I'm just going to post it there. What references do we use in our teaching? We don't typically depend on a particular reference because I think the KDIGO is what is sort of widely advertised, but in a sense, we want you to learn from real experts who interpret that evidence into their clinical practice. So let's say a particular physician is giving a talk on lupus, it'll be how they treat lupus and how they interpret the guidelines and what they recommend. We do not support any sort of like we do not do any industry advertising within the fellowship. So you won't see us promoting a particular drug or a brand of a drug or anything of that within the fellowship. We try to keep it according to what the faculty advise, and the faculty are not affiliated with GlomCon in the sense that we don't tell them what to use, or we don't have any affiliation with them or recommendations on like exact regimens. Yeah, access to histopathology, we've learned that that's quite a big thing with the whole like, so I do think we've had many fellows say that once they took this course that they were like able to interpret some of the slides themselves instead of having to send the slides elsewhere. That doesn't exactly it's not a full solution, right? Because you still don't have electron microscopy. You might not have the full gamut of stains, and so it's not a big solution, but I do think it helps you in the immediate sense. But we are trying to, that's why the pathology course was open so that there's more pathologists who could be trained in renal pathology. I know that in many parts of the world, it's not a dedicated renal pathologist, like a pathologist, trains in renal and GI and maybe a couple of other things, but to provide them specific training for renal pathology, I think that's why the renal pathology course was open. I strongly encourage anybody who's interested to join that course. Okay.
Wonderful. Anybody else has any questions? How much for the cost of pathologist? It's isn't it the same cost for
Yeah,
pathologist and
pretty
like for
sure.
everybody?
Yeah. So the GlomCon fellowship costs remain the same. It's $290, $490, and $690, depending on whether you're low income, middle income, or high income. If you're asking about the pathology certificate for GlomCon, I'm not 100% sure what that is, but yeah, I think it's very similar. I think it's the same, 690, 490, and 290 for so both fellowships, whether that be pure pathology or clinical glomerular disease fellowship, they're both kind of the same.
So I actually did the pathology certificate as well. I have to say it's also really, really good. It's just the focus, and the pathology certificate is not only for pathologists, it's for pathologists and for clinicians as well. So there's like overlap. As you know, GN is, I would say, I don't know, 50% pathology, 50% clinical, I would say. So, and everything is on the website. And I think Afran just shared the link. So this is the link that has the requirements and everything. When is the deadline, Harish? I think it's July 17th or something like that.
Yeah, I think it's coming up.
It's coming up.
Let's see when we put the deadline. I think it's mid-July. Yeah, I think it is 18th of July, I think is the last date that the applications are open. And your applications are reviewed by a panel that includes Dr. Hassanain and other faculty who were instrumental to the program, and so it's not decided by one person as to like who gets in.
Can GlomCon support local nephrology societies or institutions in developing glomerular disease course in a specific country?
Yeah, I would say that, as under the umbrella of GlomCon, we try to do local teaching sessions or local days. I think that'll be in the next few years. But we can't specifically just do that because remember, this is still most of the time that people spend on GlomCon is just still volunteering. And it's very hard to get buy-in for a lot of these things. So that's kind of why we want to do some in-person events in the next few years in different countries and across the world. But it has to be, supported. There needs to be some fiscal financial support to like doing these things. Um, Meaning the whole point of GlomCon is to make it virtual so that it's all like somewhat equitable and accessible to everybody. So, it's hard for people to like ask them to spend time to develop a course in a different country because we're asking for time to develop a course for everybody, So I think that's the hard part. But if there's some specific need that a society has or somebody has, of course, I'm happy to bring it up and see if like anybody can help.
I think there was a hand up from Fatima. I think she wanted to ask a question. You can
For the
unmute and go ahead.
criteria for getting into the fellowship, no, not at all. Actually, we actually, if you can write an honest personal statement as to why you want to do the course and explain your current practice, you don't really expect a lot on your CV in terms of like coming from a specific place or having trained in something or like having GN publications or anything of that sort. We just want to ask people to like be honest about the need for like, where they're practicing, what their interest is, and what they want to do in the future. I think that's very important to us. A lot of the time, when we see a lack of effort in the applications, then that kind of we feel like that might translate to lack of effort in the course. So if you put in an honest effort into the application itself, we don't care how big your CV is, how long your CV is, or where you come from. I think it's irrelevant. I think all we really want is for you to be really engaged in the case in the program and get something out of it, right? At the end of it, we want this to benefit patients and your community. So if you can show a need for it, then we'd be happy to have you.
I mean, one of the points that affected my rating of like applications is your commitment basically to the fellowship. So there's the more, as Dr. Sithapathy said, the more you're honest about your goals of the fellowship, uh, that's gonna easily basically translate to the committee. And this fellowship specifically, the more effort you put into the fellowship, the more you will get out of it. And that applies to basically from the application until the very end of the fellowship. So the more you put into the application, your letter of interest, your CV, your like recommendation letter, uh, it like really shows if someone is committed or not. And I think that's what we're basically looking for. Sounds good. I don't see any other questions. Dr. Amirali, do you see any other questions?
No, I don't see any. Yeah, I think unless if there are any burning questions, then they can just drop us a message or email and we can answer that. Yeah.
Well, thank you so
Sounds
much,
great.
everyone. Thanks for having me, and I hope you encourage your fellows. And if you want, if you it's you yourself want to join as well, please apply. The applications are open now, and thanks for the wonderful opportunity to speak to you all.
Thank you, Prof. It was a pleasure
Thank
having
you
you.
very much for joining us. Really, really happy to see you. Thank you.
Thank you, everyone, and have a lovely evening. Thank you, Mohammed.
Thank you very much, Dr. Amirali. I really appreciate it. Thank you so much.
Sure. Thank you to the hosts as well and the participants. Appreciate it. Until next time. Thank you. Bye.